Hello, everyone. My name is Christine Chavez. I am the Diabetes Prevention Coordinator here at the Tucson Indian Center. And with that being said, it's Healthy Heart Month. February is Healthy Heart Month, and we will be doing some videos and showing you some videos on how to get a healthier, happier heart with circulation, better food choices, and exercise, mental well-being, some cooking demonstrations, so that way you can get a little bit of ideas on how to make your heart a little happier and healthier, actually. So with that, we also have a dietitian here at the Tucson Indian Center, and you can give me a call at 884-7131 extension 2235 to make an appointment for a consultation. We also have classes that will be starting up here in February also, and along with the podiatrist and a eye exam ophthalmologist. So if you give me a call here at the Tucson Indian Center and ask for Christine Chavez, I will gladly make an appointment for you to see these three wonderful people that we have contracted to do these services for our tribal urban community. So with this, please enjoy the event. Thank you.
Welcome to Healthy Heart, Healthy Families.
This presentation is by Agnes, Yasmin, and Kelsey from the American Indian Research Center for Health.
Awesome. So we are going to start off with giving 7 strategies to live a heart healthy lifestyle. So we'll start off with 1, learning your health history. And 2, eat a healthy diet. 3, move your body, get physically active. 4, quit smoking. 5, take medicines as directed. 6, rethink your drink. And 7, monitor your blood pressure at home. We're going to go further in depth into these. Take it away, Agnes, into number 4.
Thank you, Kelsey. So those strategies are very important for your heart, because as we look at the leading causes of death for American Indian and Alaska Natives in the United States, heart disease, cancer, and diabetes, diseases that are caused by lifestyle, meaning what we eat, drink, or inhale, causes these diseases. And then in Arizona, it's the same thing. Heart disease, cancer, and diabetes are really high, and the reason why a lot of our people die. And so that's why it's important to have a healthy lifestyle.
Yes. So commercial tobacco use among American Indian, Alaskan Native populations. Among youth and adults, they have the highest prevalence of cigarette smoking among all racial and ethnic groups in the United States. And more women, American Indian women, smoke during their last 3 months of pregnancy. And a recent study also found among American Indian and Alaskan men and women have a higher percentage of smoking-related deaths from heart disease and strokes than white men and women. American Indian and Alaska Natives also have the highest rate of smokeless tobacco usage in all races in the United States. So just say no.
That is so important, Kelsey, to just say no to commercial tobacco use.
Yes, I agree.
Because using tobacco increases your chances of getting heart disease. And how does that happen? Well, smoking really hurts your heart and the veins. The veins are the train tracks that run throughout your body, and they're the ones that transport blood from your heart to the rest of your body. So smoking can cause heart disease and can lead to heart attacks or strokes. And heart attacks is when your heart is just overwhelmed with all it has to do. And then strokes are when blood clots go into your brain. So the way this happens is that tobacco has many toxic chemicals that can hurt your veins. So when you smoke, all those toxic chemicals go from your lungs to your bloodstream and into your veins, and it hardens your veins so that the blood stops flowing very easily. That means that your heart has to work harder to pump blood to your whole body. And if it's pumping so hard that it can raise your blood pressure and your heart rate. And
Mhm.
after a while, if it's pumping so hard, it weakens your blood vessels and it weakens your heart because it's just working so hard. So what happens if you are smoking and you have heart disease? Well, you can decide to keep smoking, but this makes your heart disease worse and
Mhm.
can also make symptoms such as the pain in your chest and arms or shortness of breath worse. And we also know that 1 out of 3 deaths from heart disease is caused by smoking. So, why do
Mm.
you want to smoke when you have heart disease? And why do you want to smoke since it's going to hurt your heart and your veins?
Very true. Those are great questions to ask. So here are some more facts. So if you smoke and have heart disease, what happens? Well, quitting smoking will actually help you manage your heart disease. Smoking increases the bad cholesterol in your body and it decreases the good cholesterol. So it's an inverse effect. Yeah, smoking can make your blood form sticky clots that block the flow of your heart and brain. This can also cause heart attacks and strokes. Quitting smoking will help your heart and veins. Yes. So when you stop smoking, even for 20 minutes, your heart rate returns to normal. That's crazy, just 20 minutes. And when you stop smoking for a day, you are less likely to have a heart attack. And when you stop smoking for a few weeks, your blood starts pumping through your body more easily. When you don't smoke for even 5 years, your risk of having a stroke is the same as someone who has never smoked. Those are awesome facts. And to even learn more and to help you stop quitting, you can contact the Arizona Smokers Helpline. And you can call their 1-800 number with 1-800-55-6622. You can also go to the Ashline website.
That is amazing that when you can stop smoking for 20 minutes, your heart rate returns to normal. That is
Right?
awesome. Another
That
good
is
reason
awesome.
to stop quitting.
Yes.
So let's talk a little bit more about the Arizona Smokers Helpline, which is called the Ashline. It offers free one-to-one coaching over the phone. So it means you don't have to go in person. It's very convenient. The same coach follows you through your quit attempt. So you have one person you work with. The coach also helps you make a quit plan with relapse prevention in mind, because it is very hard to quit any kind of substance, and quitting smoking is very hard. So, you may fall off, but that's okay. That's bound to happen. But the coach helps you make a plan to help prevent that. If you do fall, then what are some ways you can get back on the plan?
Yeah.
They also offer medication assistance in the form of nicotine replacement therapy, NRT, which includes the gum, the patch, and the lozenge. And these are used to provide you nicotine without smoking. And if you have access, you qualify for 12 weeks of the NRT or any FDA-approved medication. Tech support is also available if you are unable to be on the phone for a very long time, which is a really great option since all of us use a lot of texting. And talk to your Tucson Indian Center staff member to be referred to the Arizona Smokers Helpline, the Ashline. Again, you can quit. There are services available and it is free.
Yes, use your resources. Become healthier.
Yes. So thank you all for joining us for this
thank
quick
you.
session on smoking and how to keep your heart healthy. And we'll have more sessions on becoming more heart healthy and having healthy families in the next couple of weeks. So thank you for joining Kelsey and I and Yasmin, who provided us this wonderful information from the Ashline. Thank you.
Thank you, guys.
Skukdash, Anyap Jiggy Drew Harris. Good afternoon, good day. My name is Drew Harris. I'm the Native Connections Project Coordinator here at the Tucson Indian Center, working mainly with suicide prevention, developing policy and procedures here, as well as providing programming and education and hopefully passing out knowledge on this topic. I'm also a Tohono tribal member. And today, for the Healthy Heart event, thank you guys for tuning in or participating. We're Healthy Heart event mainly is all about staying physically active and how that impacts your life. But what I want to talk about in my presentation is not only having a healthy heart physically, but also having a healthy mind, and how important mental health really is, and really what our numbers are within our communities, that being the American Indian community here in Arizona and specifically in Tucson. What's going on, what are maybe some warning signs about individuals suffering from suicide, and if you're going through suicidal thoughts yourself, what are some resources, or where can you go for help? Because I think we're not sure where to go when we're going through stuff like that, or if we don't have support, it's hard to connect with those organizations or resources. So with that, I want to share that with you in this presentation. So before we do that, I did want to talk about, I kind of want to frame it in a way that we're going to start from a larger perspective in suicide rates, and so to find out what's going on in our community, because again, I think it's a very taboo subject when it comes to suicide in American Indian communities, and so because it's taboo, some of us may not know what's actually going on. What are the real raw numbers of suicide in our communities? And so if we take a look here at this slide, we see that, and we're looking here at, so these are deaths due to intentional self-harm per 100,000 people. And so this bottom line here is actually the United States suicide death rate per 100,000 people, okay? And then the top line is actually Arizona. And so the reason why that's alarming is obviously we know that there's more people in all the overall U.S. population, and we looked here at 2018 and we saw that there's 326 million people, right? There were, and it's probably more now, that being 2022. And as of 2020, Arizona population is only not even a drop in the water of that, right? It's 7 million. So if we compare the two population size, there should be no reason as to why statistically we have a higher rate of suicide compared to the US, right? So there's several reasons for that. It could be, lack of health care, lack of resources. We're really widespread here in Arizona. And I'll talk a little bit more about that and how that impacts the numbers when we're talking about American Indian populations. But there could be several reasons. Suicide's very complex, so there's no one reason as to why that may be. But this at least lets us start the conversation, and maybe starts allowing organizations to apply for more funding to help lower those numbers. Because again, it should never be, especially when compared to larger populations, our numbers should never be higher than that. So in our next slide here, we're kind of breaking it down even more now. So we just looked at Arizona compared to the United States. Now we're looking at suicide rates amongst American Indians in Arizona. Okay, and so if we look at our population, that being this dark blue line here, we see that we are higher. We are one of the highest ethnicities, races, when compared to everybody else. Okay, And again, this is a statistical issue because we only make up 4% of the whole state's population. Okay, this purple line here is the majority, which is white. So whites, when compared to whites, which I believe it's 85%, which is the majority, makes up the population in Arizona. So again, 4% compared to a 85% ratio, that's not good. So what are the reasons as to why that may be, right? They're cultural, socioeconomic, it could be healthcare issues, it could be a wide range, but I wanted to at least show you guys what this might be, and you guys within your own community can start to theorize or have the conversation or bring these statistics to the table so we can start talking about it and so we can start finding solutions. Okay, and these bottom lines here are the other minorities, right, being Black, Hispanic, and Asian. So really, we don't want to see any suicides, right? So we don't want to see any of these lines, but the fact that we're only 4% compared to the rest, and we're the highest, again, just like the Arizona to US comparison, we got to find out how to lower this. So we'll talk about that in the next slide. So again, like I said, we have a issue, we have a problem in our communities, whether we want to deny it or not. That's what the numbers are telling us. And so there might, like I've been mentioning the whole conversation, this whole presentation, that there's several reasons as to why. But I would like to start with maybe identifying, those suicidal behaviors, those warning signs within our friends and family, because that's really where we need to start. We really need to just be able to catch it first. And so that's what we're going to talk about. So I want you to ask yourself, do you know the warning signs of suicide? The behaviors listed below may be some of the signs that someone is thinking about suicide. And you got to really think about the person, the individual that you may be thinking about. And this might be you too. You might be going through some suicide ideation, or maybe even have a plan. But if you don't have support, if you're trying to reach out, and maybe you don't know what you're really going through at this time, or don't know how to put a label or a word or anything on it, what you're feeling, take a look at this list and maybe bring it up to a friend or family member, and let's see if we could get you some help, because you don't have to suffer alone. And there's many resources and quick help that you can get to treat those feelings and those thoughts. So with that, talking about it, so if you're with a friend or family member, or again you yourself, and you hear, it may not be so blatant, but sometimes it is, them talking about them wanting to die. Maybe you just, during the conversation, it's just constant, a lot of like talking about feelings of guilt or shame on a topic or issue with friends or family members. Maybe they feel burdened to others. There's a lot of warning signs in how people talk. They could be like, they even sometimes may be describing their feelings or what they're thinking is like, they're like a soda bottle that's shooken up, ready to explode. That type of stuff you really got to look out for, because we call those invitations, which is basically someone trying to reach out to notify somebody that they are thinking about suicide or getting to that point. So, it's okay to hear those things and then maybe ask directly what someone is going through, because that's most of the time that's what people want others to do is to know that they're there, know that the other person is listening to them, that they're being heard, and so they actually want to talk about what's going on, but maybe haven't found the right person or the right situation to have that conversation. So don't be afraid to do that. Start that conversation with them. Feeling wise, they can express a feeling of emptiness, hopelessness, maybe feeling trapped. They can express that they maybe have no reason to live, which is not true, right? And may exhibit like extreme sadness, anxiousness, or they may be agitated all the time, right? Just normal feelings that, like, all these are okay to feel at a certain point, but if they last more than like a week, or you see that these feelings are lasting a really long time, it may be time to just have that conversation with them, or at least be aware. Or they may be going through unbearable emotion or physical pain. Behaviors to look out for. So this is, maybe they express they actually have a plan, or maybe they're researching ways to die, which, it's very out of the ordinary. Maybe they're withdrawing from friends, so social isolation is never a good thing. It may be their clothing, right? Maybe they're covering up more, they're just not talking to people anymore. Maybe they're saying goodbye often, or giving away important items, and maybe they're making a will, depending on what age they are. Things that are just outside of their ordinary behavior is something to really look out for. Taking dangerous risks, such as driving extremely fast or displaying extreme mood swings, eating a lot or less, or sleeping a lot or less. These are all major warning signs, common warning signs of an individual who is really disturbed by unwanted thoughts or feelings of suicide. And of course, using drugs or alcohol more often, or abusing it. So, when we come across, maybe somebody that is going through this, maybe some of the things I just listed, you can easily picture an individual or friend or family member that exhibits these behaviors, thoughts, or feelings already. And, it could be scary because you don't know how to approach them. You don't know, even if you did approach them, how to connect them to the right people or to the right resources. And so that's what I want to share with you guys in this next slide. It's okay to feel that way, but it's very important that if you find that somebody is feeling suicidal, or has said it blatantly, that we connect them to help. Even if they don't have a plan or anything, we still want to connect them to some type of help. So some things I wanted to share here in the Tucson area are some available resources, because help is available. However, if you are at a point where in the conversation the person is, maybe they're on the bridge, right? Or the common metaphorical bridge that they're about to jump, or they have a weapon on them, a gun, and it's past the situation of them talking about it, then please do call the police. Otherwise, call the crisis line, which is this little graphic here. They're fantastic. They're very quick to respond, and will connect you with a counselor with 24/7. I don't think they've ever not responded when I've given them a call, and they usually show up within an hour or so, or they stay on the phone and connect you with somebody. So they're pretty great. And so the other thing, I know that sometimes it's scary when dealing with the police, right? But it is necessary to make that call when you have to make it. But I do want to make people aware that, even though you call the police in this type of situation, they, most of them, if not all of them, Sworn personnel have completed mental health first aid training, and they actually have a mental health support team that connects people with resources around the community, and really, doesn't take, I guess, that scary approach that I think maybe some people have when dealing with the police, or their fear of the police. They really do have specialized units and dedicated people for helping not only people with mental health issues but also substance abuse. So don't be afraid to reach out to them, or look them up. Their mental health support team. We are working. Tucson Indian Center will be hopefully working with them soon to do some MOUs and help us with our plan here. So they got a great team over there. And so there's some other providers that I did want to share with you, so that'll be in the next slide. So like I mentioned, some more resources in the Tucson area include that crisis line where you can talk to a counselor 24/7, 7 days a week, 365 days a year, and their number is listed here. So with all these numbers, all this listing, please feel free to take a picture on your phone, screenshot it, or write it down. I'll try to stay on this slide for a little bit, but you can call them on the 520-622-6000 number. They also have a crisis text line, which you can, if you don't want to talk to anybody, you can definitely text with the counselor as well. And again, that same 24 hours, 7 days a week, 365 days a year. All you do is text TALK to 741-741. And then there's also the Kodak substance use disorder referral lines, and they're also 24/7. And their number is listed there, the 520-202-1786. And then, of course, the National Suicide Prevention Lifeline. They're a little bit. They will connect you, if you call them, they will connect you with local resources. But I find that calling the crisis line, which is more local here in the Tucson area, it's a little bit faster. They are fast, but they'll probably connect you with somebody like the crisis line if you do call them. But they are a great resource to have just in case. Need to Talk is, so they're a warm line, peer recovery and non-emergency support by Hope Incorporated. And so their numbers are their open times are a little different. They're 8 a.m. to 10 p.m. 7 days a week. But again, they're more non-emergency. So if you do have an emergency, I would call either the crisis line or the National Suicide Prevention Hotline. And then you have if you just want some information on, some of the warning signs that I talked about, or just information overall about suicide and maybe some statistics. And you could look at the Substance Abuse and Mental Health Service Administration, or SAMHSA, their website listed there. We also have the National Substance Use and Disorder Referral and Treatment Hotline, which is a 800 number, 800-62-HELP, or 4357. And then you have the Veterans Crisis Line, which is 24-hour treatment and referral servicing for vets. So, if you were in the military at any point and you just feel more comfortable, or you feel like veteran crisis line would be more better to understand you, or if you had trauma in the past dealing in the military, they're a great resource to contact. So their number is 800. It's also a 800 number, 800-273-TALK, or 8255. One last thing I kind of want to talk about is looking at the rates of suicide for males when compared to females. As you can see by this graph, we're a lot higher in comparison, and that's been like that for a very, very long time. And so, there's a lot of reasons for that. Mainly it comes down to, well, some explanations, some theories they break it down to that, males tend to follow, the traditional gender roles of discouraging emotional expression. So basic things of, we're taught to be tough, or, not talk about how we feel, and maybe, we tend to stress rather than, or we tend to describe our emotions as being stressed out rather than sad or hopeless. And so, obviously, again, we're looking at the numbers, and it's not just something that is said, it's truth. There's a big issue when looking at, I guess, that subdivision or that subcategory. So, we want to look at that. We want to find solutions. If I'm a male, and if I ever, God bless, I have kids, and they're young men, I want them to be able to disclose how they feel, and steer them away from becoming one of these statistics. So I did want to share this with you guys. Depression may be undiagnosed in males, because again, we may not be disclosing those feelings to the doctor, or we are less likely to seek help for emotional problems. And then we also may be self-treating. We're more likely to self-treat. So however that may be, whether it's, just staying quiet, or maybe drinking more, or using substances. And so, I just wanted to bring this up because I feel like that, we do need to have that conversation. We don't want to see our dads, our uncles, our mentors lost to suicide. And so, we really got to look at this as males. I mean, females too, obviously we don't want to see them go. But it's obviously a big difference when compared. So with that, I just want to say thank you for listening. And I just want to leave with, don't be afraid to ask for help. And hope, there is hope for life always. And if you need help, please ask for it. There's, like I shared in the slides, there's plenty of resources locally. They're fast, they're quick, they're quality resources, and they can help save a life. So if you know of anyone going through some of the warning signs that we described, or maybe you yourself, please just ask for help. And I hope that you enjoyed this presentation, and I hope that you continue on to have a healthy heart and mind. Thank you.
Hello, I'm Dominique Henry, registered dietitian nutritionist. Thank you for joining me today. I hope you're enjoying the Healthy Heart event. As I mentioned, I'm the nutritionist. I wanted to chat today about the heart and what it does for our bodies and how we can keep it healthy. So I'm going to use this ball to represent the heart, okay? So each of us have one, and what the heart does is it acts as a pump. So it contracts and it releases to pump blood through our body. And the reason for that is that the blood carries oxygen, and it's important that we get a good circulation of this oxygenated blood through our body so that we can function. Okay, so the way the blood flows through our body are through our arteries, through our veins. So this is going to represent an artery. Okay, so ideally you want to keep it as clear as possible, so that way the blood can pump through without any obstruction. Okay, so those are two things. So remember, this is our pump. It's a muscle. Okay, your heart is a muscle. And there's a few things we need to do to make sure that we care for our muscles and make sure it works properly. So number one is we want to make sure we get plenty of exercise. Does anybody know the recommended amount of physical activity we should get every day? Any ideas? So we should try to get about 30 minutes of physical activity every day. Okay. And along with physical activity, you want to have a good, well-balanced diet. So that's where I come in. If anybody needs help with creating a well-balanced diet, reach out to Christine Chavez over at the Indian Center, and I can help you figure out what will work best for you. So this is just an example. We've got, we got lean proteins here, we've got fruits and vegetables, and we've got whole grains. So that's just an example of how to create a healthy, balanced diet. And then the last thing you want to do is make sure that we protect our heart and our bodies in general by limiting or avoiding even recreational tobacco. Now that's different from cultural use tobacco or ceremonial use tobacco. So just the recreational one is not really good for our bodies in general. All right. So let's go back to talking about exercising our heart muscle. So when you want to get your physical activity in, you want to make sure you're going at a moderate intensity. So that just means we're going to work our heart muscle a little bit harder than if we're just sitting here listening and talking. I'm not really having any effort right now, so my heart rate is probably going pretty at a pretty regular pace. So when you're doing physical activity, whether it's walking, cleaning the house, chasing the kids, you want to make sure that you're able to have a conversation with somebody, but you're working a little extra hard. You're gasping for air a little bit, but you can still maintain a conversation, and you'll feel it in your heart, okay? Your heart's going to be pumping quite a bit. Another thing you can do diet-wise is you want to limit saturated fats. So what are saturated fats? Those are fats that are solid at room temperature. Here are a couple examples. So we've got your cooking lard, you've got butter. So this is at room temperature, but it's still solid. It's holding its shape. All right. Those ones you want to limit. Why do you think? Well, because they're solid at room temperature, and over time, they can build up in those arteries. So this pathway that we wanted to keep clear for the blood to flow through, over time, if we have an unhealthy diet, that pathway can get blocked. So now our opening is much narrower, and now your heart has to work extra hard to pump the blood through this area. Okay, so that's when you get things like high blood pressure, or even you increase your risk for heart attack and stroke. And that's because there's things that build up in our artery walls that are called plaque, generally from high cholesterol and other things as well. So you get a blockage in your artery wall, okay? And then over time, what can happen is that this can break loose and start flowing somewhere in your body. So this little thing, if it's loose in our bodies, this is what can cause a heart attack or a stroke. So important to keep that physical activity in, healthy diet in mind, and then limiting tobacco, all right? Instead of cooking with saturated fats, which are the ones that are solid at room temperature, cook with something that's liquid at room temperature. So this is just a cooking oil. This could be olive oil, this could be vegetable oil, canola oil. As long as it's liquid at room temperature, this is going to be your better option to cook with regularly. All right. All right. So, and then the nice thing about physical activity is that you can do them in small increments. So 30 minutes a day might seem difficult for some people, but you can break them up into smaller pieces. So you could do a 10-minute walk in the morning, a 15-minute house clean, and then maybe do something with the kids outside for another 10 or 15 minutes. And at that point, you've already reached your goal of 30 minutes. Okay. So it can be anything. We just want to move our bodies. We want to make sure we're eating healthy and that we're protecting our whole body. So again, if you need any help with creating a heart healthy diet or just any kind of diet suggestions in general, reach out to Christine Chavez and she can schedule you an appointment to meet with me one-on-one. So I hope this information was helpful. I look forward to meeting and working with you all in the future. Thank you. Bye.
Men and Heart Disease, presented to you by the Tucson Indian Center Wellness Department. Heart disease is the leading cause of death for men in the United States. Heart disease refers to several types of heart conditions. The most common is coronary artery disease, which can cause heart attacks. This can be caused from a plaque buildup in the arteries. Over time, the arteries narrow and reduce the blood flow to the heart. Other types include conditions with the heart valves that cause the blood to not pump well and eventually cause heart failure. What are the signs and symptoms of heart disease? Sometimes heart disease can be silent. There may be no diagnosis until men experience the signs and symptoms of a heart attack, heart failure, or an abnormal rhythm called arrhythmia. Heart attack symptoms can feel like chest pain or discomfort in the chest, heartburn, nausea, upper back or neck pain, vomiting, extreme fatigue, dizziness, and shortness of breath. Arrhythmia is palpitations or fluttering in the chest. Heart failure symptoms include shortness of breath, fatigue, swelling of the feet, ankles, legs, abdomen, and neck veins. How is heart disease diagnosed? There are several tests your doctor can perform to diagnose heart disease. These include, first, getting a family history and conducting blood work. Your doctor may also recommend performing diagnostic tests like coronary angiogram, electrocardiogram, also known as EKG or ECG, exercise stress tests, or an X-ray. What are the risks of heart disease? Hypertension is a very common and major risk for heart disease. Being diagnosed with diabetes, being obese or overweight, eating unhealthy foods, being stagnant or inactive, excessive use of alcohol, excessive smoking. Reducing your risks of heart disease. Knowing your blood pressure number is very important. A normal blood pressure range is about 120/80. Get tested for being diabetic. Stop smoking and limit alcohol use. Get your cholesterol and triglyceride levels checked. Make more healthy food eating decisions. Learn to cope with stress better. Lifestyle changes. Lifestyle changes can reduce your risk of complications. The sooner you start, the better you will begin to feel. Your doctor can also prescribe medications to treat heart disease. If you suspect you or someone you know is having a heart attack, call 911 immediately.
Hi, I'm Christina and I'm a wellness case manager here at the Tucson Indian Center. Today I'm going to make a nopalito salad. What I use is I cheat a little and I use the jars, and I already cut up some of the nopalitos because sometimes they come out really long, and I just cut them down. What I'm going to also put in is a cucumber, tomato, cilantro, and I usually put in a red onion, but I don't have any today. So I'm going to go ahead and cut up everything and then show you the outcome. Okay, so I got everything chopped up right here. Remember that when you buy vegetables, to make sure that you wash them really well with warm water and maybe like a soap or something, dishwashing soap, to make sure that they're clean. So right now I'm going to add everything that I chopped up into the bowl, and these are the rest of the nopalitos. And then right here we cut up jalapenos to give it like a little spice to it, and then the cucumbers and the tomatoes, and then the cilantro. And then if you have like a yellow, white, or red onion, you would dice that up also in there, and it gives it a really good flavor. And then you're going to mix it all together, mix it up. And then you can put, I usually put lemon juice. I cut up, a lime juice, and I cut up a lime and just put the juice in there. And this is so easy and simple, and it's refreshing, and you can put it on a tostada or you can just eat it just like this, and it's so good. The gloves are kind of getting in the way, sorry. You mix that up. And then I kind of cheat, and I buy the already tostadas from Food City. They're already made. Just put it on top. And there you go. There's the nopalito salad on a tostada, and it's filling and it's refreshing.
Well, I hope you enjoyed this event. Remember, stay healthy, eat plenty of fruits and vegetables, drink plenty of water, stay hydrated, exercise at least 30 minutes a day, boost your immune system up with red and purple and green vegetables. You know, exercise will also lower your blood pressure, lower your cholesterol, higher your good cholesterol, you know, keep your sugar levels down. You know, remember to always take your medication as your physicians are ordered for you to take them. You know, there's a dietitian here. I would invite you, please contact me to speak with her on one-on-one basis. She also has workshops. So please, you know, give me a call here at the Tucson Indian Center. You know, we also have a podiatrist that comes in to do some workshops and teach you about how to take care of your feet. You know, especially being diabetic, having diabetes, sometimes our circulation isn't that well. Or, you know, if you also smoke cigarettes, you might want to learn how to, you know, you might want to quit, because cigarette smoking also damages your heart and causes hardening of the arteries, you know, a lot of plaque in your arteries, and it also kind of affects your circulation, and your feet are the last place, you know, where the oxygen hits, and sometimes that causes amputation. So with having if you are a person with diabetes and cigarette smoking, it can really be detrimental to your health, you know. And now with this COVID going on, you know, you need to boost your immune system up so you won't get sick, because it can cause some respiratory problems. So please be healthy, take care of yourself, do some self-care, meditate, dance, be happy, smile as much as you can. So hopefully you enjoyed that event. If you need any further information, call me at 884-7131 extension 2235. And again, thank you for being here, and we will have more events to come. Stay healthy. Take care.